A very, very warm welcome to everyone this morning. I'm just going to give a couple of seconds to let people maybe introduce yourselves in the chat. I can see that some people have started to do that. Maybe tell us who you are, what role you have, and what university or practice environment you're in, or what role you're in. Be great to see that coming in the chat so people can get a sense of who's in the call this morning. And I'm just going to give a few seconds while people start to do that and while people are still coming into the call, and then we'll make a start with some introductions. So take the time, go into the chat box, just identify who you are, where you've come from, what your role is, so that we can all get a sense of who is in the call this morning. Thank you. It's great to see everyone just signing in. You're all very welcome to what we're really excited about in presenting to you this morning. So it's great to see everyone. So I'm going to suggest we make a start while people are just still identifying themselves. My name is Brian Webster Henderson. I'm the Deputy Vice-Chancellor at the University of Cumbria. I'm a Professor of Nursing by background, both mental health nursing and an adult nurse. And I also chair an organisation called the Council of Deans of Health UK. And that's an organisation that represents over 100 universities in the UK who provide nursing, midwifery, or allied health profession, education or research. And it represents a sector voice on both education and research. It is my absolute pleasure to be here this morning to chair this seminar, this presentation, which we've called Making the Invisible Visible. What a great title around a really important subject, which is about the inclusion of LGBTQ plus health needs and concerns within nursing and midwifery pre-registration programs. And this is based on some work which has been done by a really expert research team, Professor Michael Brown, who is principal investigator, who's from Queen's University in Belfast, Dr. Edward McCann, who is a co-investigator, who's from Trinity College Dublin. Unfortunately, Dr. McCann can't be with us this morning due to prior engagements, but Professor Brown is here. And also accompanying Professor Brown is Dr. Frida McCormack, who's been the research officer who is leading on this study with Michael. And it's been great to see this study progress and explore the whole issues around inclusion within the curriculum, and to see the findings today. So today is an opportunity to hear about the study, to hear about the findings, and to really start to understand some of the issues from an education and curricular perspective for both nursing and midwifery. Key issues that will really come up today are around equality, diversity and inclusion, words that we probably use all the time, but actually are really important when we start to unpick and analyse what they mean for us as educators, as practitioners, in relation to developing others' knowledge, skills and opportunities. Today we'll also look at evidence-based curriculum, and it's great that we can see the evidence base from this study, and I think it's a really important part of this study. And key to the findings are around addressing the LGBTQ plus inequalities. And those inequalities might be through learning, they might be through curricula, they might be through practice, they might be through opportunities. There's a really key important messages coming out from this study around how to address inequalities and what some of those inequalities are. The study, as I said, was done by our three members of this research team, and supported financially by Burdett Trust for Nursing. So a huge thanks to Burdett for taking the opportunity to invest in something that we have believed is really, really important around LGBTQ plus issues. I've worked in higher education for over 20 years. As an openly gay man, I think this is probably one of the first studies that I've really seen and really been able to see the benefit of in providing advice, resources, tools, not just findings, but a whole way forward in relation to what we can positively do to make a real difference around people's learning, around some of the issues that really need to be understood in greater detail. I have some considerations for you that I'd really like to ask you to do as we listen to our speakers this morning. The first one is to really understand the significance of this report and its findings. Maybe like me, you've been to many webinars and seminars and conferences, we get inspired and then we go back to our own worlds. I'd really like to encourage you this morning to listen and to reflect on what you're hearing and to think about the impact of what you're hearing around your role and what you can do and how you can contribute to really developing and pushing this evidence base within the environment that you work in. By that, I want us to consider, what does this mean as an individual and for me as part of an organization? I'm a leader in a university, and I now have to take the findings of this report and think, what does that mean for my own nursing and midwifery programs in the University of Cumbria, and what more can we be doing to make sure that that learning journey is understood, is informed, and is evidence-based. So think today around the positive steps that we can take from today. I'm going to hand over in a minute to Professor Michael Brown, who'll start talking us through the findings of the study and the background. If you have questions at all, we'd really like to ask you to use the chat box. Identify your question. You can do that at any time through the talk, or you might want to save them up to the end. I'll keep an eye on that, and we'll bring some of those questions into conversation with our speakers as we come towards the end of this webinar. So without any further delay, I'm going to hand over to Professor Michael Brown, who is the principal investigator. Michael, over to you.
Thanks very much, Brian, and welcome to everybody. It's really exciting for us that we're here today, and thank you from wherever you have come from to join us. This has been a fascinating time for us, and we're really thrilled to be sharing this, the findings from the research project, as Brian was saying. So what we're going to do over the next hour or so is my colleague Frida and I will walk you through what some of the wider literature and evidence base is, the kind of background to the research study. We've undertaken a range of nursing and midwifery focused reviews of the research, looking really at where LGBTQ plus health sits within nursing and midwifery programs on a national and an international basis. So we've looked at this from a global perspective, and I'll share some of that kind of wider evidence and context. And again, if anybody's interested in any of the literature that we talk about, any of the studies, any of the resources that we've got, please do get in touch. I think our email addresses will appear towards the end. Then Frida's going to go on and talk about the methodology and the findings, what we actually did, what people told us. And then the kind of interesting bit, I think, is what we conclude as we've looked down across the 4 countries of the UK and the Republic of Ireland. We were very, very mindful not to overload colleagues with recommendations of what people should do. So we tried to keep them very short and very focused, and hopefully helping people to look at their curriculum and programs to be very outcome focused. And then, as Brian said, towards the end, there'll be a kind of open forum chat and any closing comments, and we'll be sharing the report and the findings with you to take away electronically at the end of the day. So that's what we're planning to do. And as Brian said, please do use the chat. Any questions, any observations, Anything that you're doing in your school that we would be thrilled to hear. So I'll switch my camera off. You've seen enough. That's the beautiful library there at Trinity College in Dublin. As Brian said, this study has been a partnership between Trinity College Dublin and Queen's University in Belfast. And we've been working in this space for quite a long period of time, building up the evidence base. Eddie McCann, who, as Brian said, unfortunately can't be here, he's got a mental health nursing background. I've got a learning disability background. And we came at this very much from a perspective of practice and how mental health service users, disabled service users who are LGBTQ+, experience using health and social care. That then led us to be looking a lot at around what gaps were. That then led us to have conversations with the Burdett Trust. They have a very important funding stream which allows them to commission and invite research proposals. So rather than submitting applications for open peer review, they approached us and they commissioned this piece of work because they were conscious, as a charity who's particularly interested in funding nursing and midwifery research, that they hadn't really had a large focus on LGBTQ+ people. They also tend to commission around specific areas of interest. So they looked at mental health, child and adolescent mental health. They looked at learning disabilities, BAME, and they were really conscious that LGBTQ+ had not been an issue that they had focused on. Hugely grateful to Brian and the Council of Deans. As you'll see as we move through the study, there are something like 135 schools of nursing and midwifery across the UK and the Republic of Ireland. About 50% offer midwifery programmes, and the other 135 offer adult nursing, mental health, children, learning disabilities, or a combination of those. So it's a very complicated picture. Trying to gain access to the right people at the right time across 135 schools to try and recruit them was a major challenge, and really have to acknowledge the help and support that Brian and his colleagues at the Council of Deans gave us, because without that help and support and Brian's kind of wisdom and know-how, he was on the project advisory group, but he also met with us on numerous occasions out with that, really to act as a kind of advisor and companion to help us navigate through a very complex system and very complex processes. We were particularly interested, as we've said, in LGBTQ+, and that's the anachronism that we were advised to use. There's a whole range of them. It could have been LGBTI, could have been LGBT. The one that we opted for was LGBTQ+, and we were particularly interested in where LGBTQ+ health sits or does not sit, as the case may be, within nursing and midwifery programmes across the UK and the Republic of Ireland. We were specifically calling them pre-registration programmes, as those of us who work within education will know. There's been major changes over the past years where nursing has moved to degree level. There's increasingly master's level entry. So often programs are delivered at undergraduate level, BSc, BA, BN level, but some of them are increasingly being delivered at master's level. So we're thinking about whatever those pre-registration programs are, where the graduates will be registered as a nurse or as a midwife. That was what our focus and our interest was. We adopted a mixed methods research design, and Frida will share a little bit more about that. And as I said, we tried to engage with all schools of nursing and midwifery across the UK and Ireland. We did engage with them all, and you'll see as we get to the methods part of the study, exactly what the kind of engagement levels were. The first part of the study involved UK and Ireland-wide survey, which are notoriously difficult to get responses, but Frida will tell us more about that. And then there was the qualitative element, which is the really kind of interesting bit, I think. So as Brian said, we need to thank the Burdett Trust for their insight in recognising that more needed to be done here and for providing funding for us. We also need to thank the participants in the survey and those that gave even extra time. Hopefully some of them are here, who participated in the qualitative elements of the research. And I really need to thank the advisory group. They gave very generously of their time. We exploited them mercilessly in terms of their wisdom and their expertise. And I just want to run through who they were. There was Fidel Lim from New York. He was somebody that Eddie and I had engaged with right at the very beginning. He had undertaken research in New York across in the United States, looking around LGBTQ plus health and the nursing programs there. Julia Taylor is an academic from Tasmania in Australia, and she has probably undertaken the most comprehensive research study in the world at the moment, looking at bisexuals, and we were very interested in bisexual health. Joseph Noctor was a student representative from Trinity College Dublin, and again, it was really interesting having the student voice and the student take on how we might address some of these issues and the problems. So a big thank you to Joseph. Wendy Irwin, who is from the Royal College of Nursing, was excellent as well, linking us in with people. Wendy, again, was always emailing us, sending us resources and bits of advice. A colleague of mine who I used to work with in Edinburgh, Caroline Hollands-Martin, is a consultant midwife and professor of midwifery or maternal health. And Caroline, again, was kind of excellent. Edward's background and mine is as registered nurses, not as registered midwives, and we're acutely aware that midwifery is a separate profession in its own right. There was Vanessa Lacey from the Trans Network, Eloise Stoneborough from Stonewall, Sophie Melville from Stonewall, Paula Fagan from LGBT Ireland, who was excellent, Karen Murray from the Royal College of Midwives. I need to mention Jenny McNeil, who's Senior Lecturer and Professional Lead for Midwifery at Queen's in Belfast, a good colleague of mine. Jerry McLaughlin, who's Programme Coordinator for the Midwifery Programme at University College Cork. And then finally, Gráinne Donoghue, who is a Research Fellow at Trinity College Dublin, and she was very involved in literature reviews and searching and giving us advice around that. So really just to acknowledge them, because they worked tirelessly with us and supported us in so many different ways. And I think their kind of knowledge, skills and expertise of LGBT issues and concerns, of the nursing concerns and the midwifery concerns were central to the effectiveness of the study. And there's somebody who I do need to mention. Hopefully he's online. He said he was going to try and join us. His name is Gary Gilmore. He's the graphic designer who worked with us from quite an early stage, actually, in the production of the report in terms of trying to capture these notions of LGBTQ+, of nursing, of midwifery, of education, and of health. And we're going to give you a copy of an electronic copy of the report towards the end. And I don't know if he's looking for business, but if anybody is looking for a high flyer graphic designer, we were thrilled to work with him, and hopefully you'll really like what he has done for us when we share the report. So what did we actually do? It was a 3-phase study. The first part that we looked at, that had actually been ongoing for a while, was looking at policy for the educators who work in nursing and midwifery education. You'll be very well aware of the Nursing and Midwifery Council, pre-registration standards for nurses, for midwives. The Nursing Midwifery Board for Ireland has parallel similar standards for nursing and midwifery programmes. So we were very keen in the early stages to analyse those standards and what they actually said or didn't say specifically about LGBTQ plus health. They actually, understandably, I think, don't specifically mention LGBTQ people. They do talk a lot about inclusion, equality and diversity, health inequalities. And I don't think that there would be any sort of big surprises there. You would expect that education programmes for nurses and midwives would be focusing on issues like that. And they certainly do. But they don't go on to really articulate very clearly what programmes need to focus on in relation to LGBTQ plus health. And we think that that could potentially be a little bit of an issue. We extensively reviewed the research literature. Edward and I have been publishing for some time around health needs and health concerns, particularly biopsychosocial concerns around healthcare access for LGBTQ plus people. And we've published literature about lesbians, bisexual, gay men, transgender people, all kinds. And then we started to move into looking at literature around educationally what needs to happen. As we said, we went across the whole of the Republic of Ireland and UK-wide in terms of the survey of current nursing and midwifery programmes. That then led to the analysis and synthesis of the phase 1 data along with the literature. Really then moved on to invite participants to self-select in for qualitative phase 2 part of the research study. And a number of people from across the UK and Ireland opted in. We got participants from the survey from across the 4 countries of the UK and the Republic of Ireland. There was then an opportunity to select and identify people from across the 4 countries of the UK and the Republic of Ireland to participate in the qualitative interviews. We were trying to also capture city, urban, rural, where we possibly could. For example, in Scotland, there's University of the Highlands and Islands that delivers nurse and midwifery education away up to Orkney and the Shetland Islands and the issues that may present there. So we did our very best to try and get a broad sweep of interviews and participants for that part of the study. Then there was massive analysis of data. We did a mapping exercise across the nursing and midwifery standards from the NMC and NMBI. And this then assisted us to develop what we've called a best practice education guide, really to help academics to think about where are we delivering LGBTQ plus health now, and what are the opportunities for us maybe to do more in the future. We're now at phase 3. It's hard to believe. I don't know where the time's gone. So we're at the dissemination phase now. Publications have come out. I'm really excited. Our first publication based on the study findings. This is Spooky Karma, was published today. I just got the email before we came online. So that was really exciting for us, and we'll share the reference for that towards the end with you. And ultimately, what was the big motivation for us in wanting to do this study? It was really about evidence-based education to improve care, support practice and innovation to meet the needs of LGBTQ plus people whenever they're accessing nursing or midwifery care. That was the big ticket here. That's what motivated us, and hopefully we've contributed to that. So the project advisory group, as I said, it had experts from LGBT groups, academics, students, professional bodies. They were fabulous in helping us to source literature and resources. We've tried to collate some of them as best as we can, because there's a very rich source of literature and evidence and resources that could be very useful for academics who are delivering nursing and midwifery programs. So there already is stuff out there, and we've tried to pull them together with some suggestions of how they might be used. Where possible, we try to identify best practice examples regarding the inclusion of LGBTQ plus health within these nursing and midwifery programs, and they're in the report, and really just about how we exploited the advisory group for their advice and guidance, and hopefully they're going to support us further with the dissemination of the study report and the findings, and most importantly, what we think needs to happen moving forward. So many people here, I imagine, will be familiar with some of these wider concerns and issues. There's been a range of reports, particularly over the past 20 years, I would say, looking at the adequacy or perhaps the inadequacy of healthcare for the general population. And we're particularly interested in subpopulations of the general population. So mental health service users, for example, people with disability, for example. And then we became particularly interested in access to healthcare and equality of health outcome for LGBTQ plus people. And the Health Service Executive in the Republic of Ireland back in 2018 has had a focus on adequate healthcare, and the Department of Health in England in 2017. World Health Organization has had lots to say around social inclusion, human rights, and equality of access to healthcare. And they have specifically reported on and commented on issues and barriers in relation to LGBTQ plus health, and that these barriers that then contribute to discrimination, marginalization, and at the end of the day, poorer health outcomes for some people who are LGBTQ. The literature says quite a lot, actually, about what is fundamentally negative attitudes and lack of confidence and experience within healthcare services on behalf of healthcare professionals when they come into contact with LGBTQ plus people. And that certainly came out in the findings from our study, and it's certainly there in the research literature and research, wider research. The literature and the policy talks a lot about the bio, the psycho, and the social concerns and needs, and in particular, the cultural needs of LGBTQ plus people. We're a global society now in the Republic of Ireland and in the UK, and we have people from all over the world who have different cultural backgrounds, different religious backgrounds, different spiritual backgrounds, and who will have different community issues regarding LGBTQ plus people, and therefore all of these issues culturally can impact upon them when they access health and social care, and ultimately on the health outcomes that they experience. What these policies talk about is health services that should be responsive, appropriate, well-resourced. Nobody's going to argue with that, but as we found from the wider literature that we've looked at, and also from the experiences of many LGBTQ plus people, that's not always a reality for them. Probably across all the literature that we have reviewed and that we've published, this issue of the need for knowledgeable, skilled, and I'll add confident health practitioners, which includes nurses and midwives, is a recurring issue across all of the studies that we've looked at. So there's some of the wider issues and concerns, and we think there's important contributions that nurses and midwives can make and do make in relation to addressing the health concerns and health needs of LGBTQ plus people. So that's that wider context. So just a very brief overview. As I said, we've published extensively, as have many other people, And when you think about the psychosocial concerns of LGBTQ plus people, there is very clear evidence-based, well-established evidence-based looking at their mental health concerns, their psychological concerns. Levels of depression are particularly high. Something I want to highlight for people to think about is we use LGBTQ plus or LGBT, LGBTQI very quickly as a catch-all when we're thinking about and describing this particular group of people. In many of the studies and the work that we've published, we've started to deconstruct this L, the G, the B, the T, the Q, the I, because when you look at the health profile of, for example, lesbian women, it differs from that of gay men, which differs in turn from the health profile of bisexuals and trans people, for example. So whilst I understand why we use a shorthand, we need to be very mindful that within that shorthand terminology, the health needs, the health profiles differ across lesbians, gays, bisexual, and transgender people. So that's a really important point in terms of us as educators thinking how we integrate this. So depression and anxiety is probably the two most commonly ranked psychiatric issues that you will find within across the LGBTQ plus populations. Suicidality in terms of trans people is an issue. Eating disorders for gay men and trans people can be an issue. Alcohol and substance use is recurring across many of the studies that we've looked at. Victimization, violence, and abuse can be fairly common. We've just published work about LGBTQ plus people in prison, and a lot of issues around victimization and violence and trauma, post-traumatic stress for those groups. And another big recurring issue is stigma and discrimination and social exclusion. And all of these issues collectively impact massively on the psychosocial lives of LGBTQ plus people. And from a physical health point of view, I mean, going back over the past 30 years plus, HIV risks and STI risks, there was a lot of research, obviously, in the 80s and the 90s looking at gay men, but there's increasing studies looking at issues of heart disease, obesity, cancer, and again, thinking about separating out lesbian, gay men, bisexual, transgender, for example, you'll find a slightly different physical health profile. Why we think this is important, if we don't understand and recognize the similarities and the differences across the health profile, our education, our interventions and supports are not going to be targeted and specific to the needs of the subpopulations that sit within LGBT groups. So that's just a little bit of the health concerns there. This was one of the papers that we published that's attracted a lot of interest. It always astonishes me that people read what I write, but this was a paper that's attracted a lot of interest. It was really looking at health issues within undergraduate education programs. We went slightly wider for this, not just looking at nursing and midwifery, but we were looking at pre-registration, medical, nursing, AHP, social work, and then on to CPD programs. And that was a really interesting piece of work. There is literature, there is evidence, there is work going on regarding LGBTQ plus health and its integration within nursing undergraduate pre-registration programs. I would say from that literature, it's patchy, it's opportunistic, and it's not clearly embedded and weaved throughout the research literature. There's not a massive body of research evidence, but it is increasing and it is growing. And again, very happy to share any of those findings with you. This year, we published the first ever systematic review looking at critical appraisal and synthesis and best practice of LGBTQ+ health in relation to midwifery care and support. Those findings were published in Midwifery, which is one of the high impact midwifery research journals. And I'll talk a little bit about that because it's really interesting, because there's been not massive amount of work done in relation to midwifery care and LGBTQ+ people. However, I do need to emphasize that that does not de facto mean that there's not good practice going on, that there's not examples of LGBTQ+ health being integrated within nursing and midwifery programs. It could just be that it's not being researched and then published and reported in the research literature. So that's an important point to make. Systematic review. There were 9 papers looking at, out of 139 that we identified, that were really looking at the experience of LGBTQ+ people when they access and use maternity care. And we really looked at this from the perspective of people who were LGBTQ+ people who were contemplating pregnancy, their experiences of antenatal care, their experiences during pregnancy and labour and what their issues and concerns and experiences were, and then their ongoing postnatal care afterwards and the kind of supports that they require to access. And we identified a range of issues for midwifery policy, practice and education. And we were delighted that Professor Caroline Hollins-Martin and Karen Murray from the Royal College of Midwives was able to co-author that with us. So that was co-produced with the advice and guidance from senior colleagues from midwifery. So some of the findings that are actually similar in terms of the nursing literature as well as the midwifery is, and there'll be no big shock surprises here, LGBTQ+ people really want their unique needs and individual circumstances to be recognised and responded to. We've evolved this phrase that we've started to use over the past couple of years in relation to this family constellation, this kind of rainbow family, that there is no 2.4 children or whatever it is, that families come in all shapes and sizes, colours, and that the rainbow element for LGBTQ+ people is a part of that and needs to be recognised, and it's been evolving over time. Something that I would say is common across the studies for nurses and midwives is the heteronormativity in terms of language and the assumption that heteronormativity is the norm for everyone, which we know isn't true. A really interesting issue that arose in a couple of the papers, and I think this is going to be an emerging one. We'll all be familiar with the surrogacy concepts. We have Elton John, David Furnish, there's the diver Tom Daley. So it's attracting a little bit of interest. There has been research done, I think, in Sheffield, that's just recently been undertaken. Hopefully they're going to publish on that soon. There is a little bit in the midwifery research literature about surrogacy, but that I think is an interesting one and will be an evolving issue. What came out strongly was that the prenatal care and the reception that LGBTQ+ people receive when they enter into maternity care is really important. And it gets complex, for example, if you think about a trans person who has gone female to male and then decides to go back to female again in terms of their reproductive health to become pregnant. So these are kind of issues that I think we need to think about how we introduce them early into our pre-registration programs for nurses and midwives. People may require obstetric care, maternity care, and gynecological care. So just some kind of issues there. Something that also came out of the literature was sometimes the feeling of discomfort and awkwardness on behalf of LGBTQ plus people, and the midwives who were running the prenatal sessions, not quite sure what pronouns to use, how to refer to people, how to include partners, what their status was. And therefore, as a result, there's important education issues there. And gender variant gestational parents is a kind of issue that's just starting to emerge in the midwifery research literature. An issue that came up across some of the studies was this hiding sexuality, gender identity, really for fear of discrimination, being judged, of the concept of minority stress. For some people, not all. I do need to emphasize that there is evidence in the midwifery research literature of very positive practice, very positive experiences for some LGBT people. And they also talked about feeling isolated and lonely when within maternity care. An interesting one that came out in relation to lesbian parents was this issue of feeling judged and being an object of curiosity, where people weren't quite sure what to make of them. It wasn't familiar or common to have many lesbian parents in, and therefore they felt that they were objects being scrutinized from the outside in. And there's really important roles here for nurses and midwives to improve the care experiences of LGBT people. So some of the kind of just conclusions, and I'm talking about this one more because we've just literally it's the first to be done in this space. So there's an opportunity around the midwifery policy standards and guidelines really to kind of embed and reflect LGBTQ plus people and their concerns within undergraduate, postgraduate and CPD education, and maybe to look at how we can improve some of the outcomes and whether there is more research that can be done in this space to grow and evolve the evidence base. So any budding doctoral midwives that we may have here, this may be an area of interest to you. So what we do know from the research evidence is that LGBTQ plus people are frequent and high users of all aspects of healthcare services, whether it's for their physical needs or their psychological needs. We will find them in all aspects of our healthcare system. Some of them, even to this day, may be reluctant to expose their sexuality and their identity, often because of fear of discrimination, minority stress, and feeling awkward, and that recognizing that health professionals may not have the necessary knowledge, skills, and language to respond appropriately. This then, from their perspective, can lead to negative healthcare experiences. And what we found from the literature that we looked at is that LGBTQ plus health and its inclusion within education is very patchy, it's highly variable, and therefore there's an opportunity and a need to increase its visibility within our pre-registration nursing and midwifery programs. So some of the that then led to us analysing the literature, looking at what the research questions were that we wanted to address. And what we were interested in was these 3 questions. And it really was what the education and training requirements are of undergraduate students. What are the current approaches that are being used within education regarding LGBTQ plus health? And what are the best practice examples that we could identify of what's currently taking place? So that's a bit of a walkthrough of the literature and the evidence and the wider context. And Frida, who is a fabulous person and who kept me and Eddie right throughout this whole process, is now going to walk us through what some of the research methods and the findings were. So thank you very much.
Thank you, Michael, and you're only as fabulous as the ones you work with. Thank you for giving us that background and insight into the project. I'm going to turn my camera off now as well. I would also like, before I start, to sincerely thank everyone who completed the survey and participated in the interviews. This certainly provided us with rich data. I would further like to thank Burdett Trust, the Project Advisory Group, and again, Gary, our graphic designer. As you will see towards the end, the fantastic report that he has published for us and the publicity materials. So thank you to everybody who has helped us along on this journey. Okay. The study was initially approved by Queen's University Belfast and Trinity College Dublin's Ethics Committees. After much preparation, getting the documentation in order and working out our survey questions and questionnaires, we decided to go live with the study on the 30th of October 2020. And it just came to mind this morning, how ironic is that? It is almost a year to the day today. On that day, we emailed approximately 135 heads of schools of nursing and midwifery in the United Kingdom and Ireland. We also had a notice published in the Council of Deans Health newsletter, and again, thanks to Brian for facilitating us with that opportunity. This included information about the study and a link to an online survey. After the initial dissemination on the 30th of October, a few subsequent emails and notices were also sent at various intervals. We were aware whenever the information was received, there may be coercion within schools. So to avoid this, the head of school was asked to forward the information to an administrator, and that was for them to identify academics within their school who had experience of delivering LGBTQ+ health in the nursing and midwifery programmes. It was the role of the administrator then to forward the information to those academics they had identified, inviting them to participate in the online survey. So between October 2020 and March 2021, we were really fortunate to get 29 completed surveys, which actually represents a 39% response rate. And as Michael has said, we also managed to get responses from across all 5 nations. We had 14 from England, 2 from Scotland, 3 from Wales, 1 from Northern Ireland, and 9 from the Republic of Ireland, as you can see from the map there on the right. And also we had both nursing and midwifery represented. The survey was able to be completed online via a Microsoft form and consisted of 36 questions. After providing initial details on the study, it started with questions about demographic data, such as programmes offered within the various institutions and the numbers of pre-registration students. This was then followed by a series of questions relating to, for example, the importance and content of LGBTQ+ health in nursing and midwifery pre-registration programmes, the importance of having a dedicated team, and also involving the LGBTQ+ community organisations. We also include questions about the importance of training and development for academics. Most of the questions had a multiple choice response, such as not important, slightly important, fairly important, important, or very important. Or maybe it could have been never, seldom, sometimes, often, or always. And some of the questions also invited free text. This was to enable someone to expand on their response. The final question on the survey asked if the individual would be willing to participate in a follow-on interview. And again, we had a really good uptake. We were absolutely delighted that 21 respondents opted in and subsequently gave consent to take part in an interview. As we wanted to include academics who were currently teaching LGBTQ+ health across nursing and midwifery, and also representative of the 5 nations, we identified a purposive sample. Although not everyone was available to take part, we did, however, manage to carry out a total of 12 individual interviews, all of which were done online, because this was at the peak of COVID as well, via Microsoft Teams. Each interview lasted between half an hour to an hour. And again, as can be seen in the graph, there was a geographic spread and the interviews represented both nursing and midwifery. Some of the questions we asked during the interviews were about how academics had developed and agreed the content of their programmes, and then integrated LGBTQ+ health issues and concerns within their pre-registration nursing and midwifery programmes. We also asked what teaching and learning approaches they were using, how students were assessed on their LGBTQ+ knowledge, skills and attitudes, and also whether or not any quality assurance strategies were being used to support LGBTQ+ health in the programmes. We were particularly keen to find out what was working well for the academics and who else they might involve in the design and delivery of the programmes. We were looking for examples of good practice and innovation, and we certainly found that, perhaps mostly from individuals who have a particular interest in the topic and who had taken the initiative to include LGBTQ+ health in their programmes. All interviews were recorded and transcribed, and each transcript being assigned a gender-neutral pseudonym to ensure anonymity. So the next stage of the process was the data synthesis, and the objectives of this element were to analyse and synthesise the data from the survey and the interviews, to identify the extent of inclusion of LGBTQ+ health needs and concerns within the nursing and midwifery pre-registration programmes. Also to identify best practice in curriculum planning, delivery and evaluation. And finally, to develop the content for inclusion in the best education practice guidance. So as a research team, we analysed the data both individually and collectively, and from that 3 main themes and sub-themes emerged, and I'll take you through each of the themes, and there's more detail on the themes within the final report as well. So the first theme was cultural competence and inclusivity within the curriculum. The importance of addressing LGBTQ+ health issues and concerns within the pre-reg programmes within academic meetings was considered very important by the majority of survey respondents, with 37% in nursing and 44% in midwifery. Although it's not a specific requirement in the nursing and midwifery standards, participants were keen to have a formal structure and content to ensure LGBTQ+ was not just considered tokenistic. But in the absence of defined standards, informal and individual drives were being taken, particularly by those academics who had a background in sexual health or perhaps just had a personal interest. But despite the lack of a prescribed curriculum and standards to follow in relation to LGBTQ+ health, the participants were keen to make a contribution, and they were determined to get it right and had used innovative means. Whilst 50% of nursing and 68% of midwifery respondents considered it very important to provide content and to integrate LGBTQ+ health issues and concerns in the pre-registration programme, only 10% and 6% respectively felt that such inclusion was fully adequate. This was also reflected in responses pertaining to how often LGBTQ+ I just noticed there somebody's having difficulty with my mic. Sorry, but hopefully this might help. This was also reflected in responses pertaining to how often LGBTQ+ topics were delivered within the pre-registration programmes. For both the nursing and midwifery, the majority of responses selected was never, seldom, or sometimes, with a minority selection of often or always. Quite often it would be subsumed with other topics, or perhaps linked in with equality, diversion, and inclusion. There was an awareness that society had changed and students were more receptive and open-minded to discussing LGBTQ+ health-related issues than they would have been in previous years. This was undoubtedly a challenge for some of the older participants, with one questioning with their students if there was still a need to teach the topic, and others feeling inadequate in what they had to offer the students. There was also recognition that language relating to LGBTQ+ people had also developed over the years. A willingness was undoubtedly shown amongst the participants that they wanted to use the correct LGBTQ+ terminology and pronouns when teaching their students and communicating with LGBTQ+ people. However, this was challenging and undoubtedly contributed to stressors. Societal changes were reported as becoming more prevalent and visible, particularly, as Michael has said, in maternity services, due to an increase in lesbian mothers and transgender people accessing the service. This shift also highlighted changing family structures and dynamics. It was encouraging to see that additional training and education was being provided to ease the frustrations being experienced and to provide the level of service and communication that is required. Participants were also mindful of the challenges across the lifespan, and particularly when looking after LGBTQ+ people in their later years. That leads me on to theme 2, which is LGBTQ+ health-related issues, and under this here we had 4 sub-themes. Responses to the survey revealed that the hours of teaching allocated to LGBTQ+ health in pre-registration nursing and midwifery programmes, it ranged anywhere from 0 up to a full week. The interviews further revealed that very often the scope and content were the decision of the academic responsible for delivering the sessions, and included elements such as microaggressive language, gender-inclusive terminology, and some problem-based learning scenarios. But irrespective of the duration of the programme or session, the value of preparing realistic content based on the real-life needs and situations experienced by LGBTQ+ people was viewed as important. The scarcity of LGBTQ+ health in programmes raised questions during some interviews as to whether students were being prepared adequately for the wider national and international work, rather than maybe just focusing on their local area. There was a range of teaching and learning approaches being used to deliver LGBTQ+ health, which were synonymous with other subjects. These included case studies, lectures, group discussions, and online seminars. There was an overwhelming sense that the participants were also keen to involve their students and service users and really valued their openness, experiences, and knowledge of LGBTQ+ needs and concerns. The provision of education and skills training for nursing and midwifery students was considered very important by 43% and 55% respectively by survey respondents. However, during the qualitative interviews, it was noticeable that skills simulation rarely included an LGBTQ+ context. For some, this was perhaps due to cost, and for others, the idea had not occurred to them. However, there were some excellent examples of how skills simulation had been used in transgender, same-sex parents and surrogacy scenarios. Only one participant used an assessment strategy. It was a quiz to evaluate their students' specific knowledge and understanding of LGBTQ+. This was done on completion of the module using an online learning platform. The other participants had no specific assessment strategy regarding LGBTQ+ health, but there was an expectation that it would be mentioned or chosen as an option, perhaps in case studies, assignments, or a dissertation. The qualitative interviews did, however, provoke some thought on assessment strategies. And our third theme was the curriculum evaluation and delivery. All participants were asked what quality assurance mechanisms they used to support the inclusion of LGBTQ+ specific health needs and concerns within their nursing and midwifery programmes. A few responded that quality was part of the equality, diversity and inclusion agenda, but generally there was no formal quality assurance in place. There was more of a reliance on personal standards and informal scrutiny. The absence of any requirement from regulatory bodies to include LGBTQ+ health in the curriculum led to participants developing and delivering their own programmes. For some, their willingness to do this was driven by a personal interest in LGBTQ+ issues, whilst for others, they undertook to do it because there was no one else available, or perhaps they were just expected to do it. There was a mixed response as to who should actually teach the subject and deliver it, with a small minority expressing that it should not just be those who are enthusiastic and passionate about it, but that everybody should be able to do this, so long as they are prepared. A small majority of survey respondents considered it important or very important to have a dedicated team with specific responsibility to integrate LGBTQ+ health needs and concerns within the pre-reg nursing and midwifery programmes, with 58% and 55% respectively. There was also support for involving the LGBTQ+ community wherever possible. There was a noticeable variance in the confidence level of academics when it came to delivering LGBTQ+ health-related issues, with some feeling more vulnerable than others. This resonated with the study carried out by Lim et al. In 2015. A majority of 71% nursing and 65% midwifery of survey respondents deemed it very important to provide development and training for academics with regard to the integration of LGBTQ+ health needs and concerns in the pre-reg programmes. However, this was rarely provided, with a reliance on general equality and diversity training. Only 3 examples of specific LGBTQ+ health training were cited by the participants, and these included sitting in on each other's sessions and informal talks with colleagues. So just to give an overview of the study findings, the survey responses and interview data revealed that the inclusion of LGBTQ+ in the pre-registration programmes is limited, with a need to increase visibility across the curriculum. There was a reliance on general equality, diversity and inclusion training, which did not always include LGBTQ+ issues. The teaching and learning approaches were varied. Some programmes were in the very early stages of development, whilst others were well developed and integrated. We liken this to the analogy from little seeds to acorns. However, this variance and developmental work also impacted on the confidence of academics. Undoubtedly, there was a longing for direction and guidance. It was interesting to notice a Hawthorne effect being created during some of the interviews. As a result of some questions, there was a sense of enlightenment or sometimes a feeling of guilt, which prompted individuals to consider taking action and improving what they were already doing, particularly with regard to simulation and assessment. The results of this study are reflective of the wider research evidence base and do mirror the findings of McCann and Brown, who highlighted in 2018 that a consistent approach was needed across all undergraduate health programmes. So from the survey and the interview data, we went on then to look at best practice innovations. And undoubtedly, there were some excellent examples of how LGBTQ+ health is being integrated and embedded in nursing and midwifery programmes. These included case studies, input from members of the LGBTQ+ community. There was also a scenario which was set at the start of the year and then built upon as the teaching and learning progresses. We had projects and assignments, and awareness of the use of terminology and language. However, there was minimal emphasis on transgender and the challenges facing healthcare professionals in maternity services. So from that there, we then went on to develop the LGBTQ+ education guidelines. And for this, we collated all the information into an education guide, which aims to inform the development and inclusion of LGBTQ+ health for those nursing and midwifery students in pre-registration programmes. This was guided by the findings from the data of the study, and key topics deemed most relevant to nurses and midwives were included. The aim of this resource is to provide insight and inspiration into innovative and creative ways to assist and encourage the inclusion of LGBTQ+ health in nursing and midwifery programmes. As shown, we divided it into subject areas which can inform the development and inclusion of LGBTQ+ health within programmes. We have suggested learning objectives for LGBTQ+ health, such as the recognition of LGBTQ+ characteristics, and the competent use of language in the setting of LGBTQ+ healthcare. A particular area, as we've already said, that stood out was maternity care, and we've therefore also included some additional learning objectives, such as awareness of different types of LGBTQ+ families and their distinct needs and concerns, and approaches that could be implemented to reduce childbearing LGBTQ+ clients' levels of anxiety and fear of disclosure of sexual orientation, and also their partner's involvement. We became mindful of the limited knowledge and indeed time some academics had when it comes to developing LGBTQ+ programmes and accessing appropriate resources. Therefore, we were keen to provide examples of education activities and methods of assessment and evaluation that can be used. General subject areas, which indeed could be used in any LGBTQ+ health professional programme, were included, which, as you can see, include terminology and definitions, a timeline for LGBTQ+ equality, and communication and language. We have referred to LGBTQ+ individuals across the lifespan and separated them into midwifery, children and youth, and older LGBTQ+ adults. Within each of these areas, we have included issues relating to that stage in life and what kind of actions healthcare professionals can take to support and care for these people. At the end of each interview, participants were asked to reflect on what they had already achieved and if they had any advice for other nursing and midwifery colleagues. As you can imagine, this certainly provoked some thoughts. We are really grateful for the advice and suggestions put forward from personal experience and have collated these into a tips and advice section. We have also included a library of LGBTQ+ services and resources and some academic literature, which hopefully will form a basis for ease of accessing information. So we do anticipate that utilisation of these guidelines will improve access to a positive healthcare experience for LGBTQ+ people through confident, competent and knowledgeable and skilled practitioners, including nurses and midwives. This can be nurtured with the inclusion of LGBTQ+ health in pre-registration and CPD programmes, thereby enhancing practitioner competencies in their care, treatments and supports to patients. More information on the study findings can be found in the final report, which we will make available towards the end of this event, and it will also be available online. I would like to thank you all for your interest and again for participating in the survey and question and interviews. And I will now hand back to Michael, who will tell us about the conclusions and recommendations. Thank you.
Thank you so much, Frida. So it's back over to me as we move forward to the last bit. So ultimately, if we were looking at the big ticket outcomes, what is it we think actually needs to happen? And we tried to keep it simple. As somebody who's been in and around education for a long time, I recognise that every time we evaluate programs, we update them, we revalidate them, everybody wants more stuff to go into the program, but we're not so good at taking stuff out. And that presents us with a range of opportunities, but also a range of challenges that we need to address. I don't actually think that addressing this issue is a complicated one. I think it's about bringing together a strategic approach across your university, looking down on your program in terms of your current theory modules, your skills simulation, your practice learning opportunities, and your assessment strategies, and thinking, what's the thread that starts at the very beginning, and how might we weave a small thread across the curriculum and the program that starts at the very beginning through to when the students exit and register with the Nursing Midwifery Council or NMBI. And what is it we would want students to leave our programs with? And I suspect it will be something around positive attitudes, values, and an increasing confidence about how to work with LGBTQ+ people wherever that may be, because as we know, the destinations where our students go are exceptionally wide. So I think it's about looking at our programs and keeping it simple. If, for example, you put your hand in your heart and you say, our curriculum's not actually doing that much around LGBTQ+ health, there's an opportunity there to think, where might we start to embed some of these issues from a theory perspective? And then opportunities when we're looking at case scenarios, practice learning, and skills learning around where maybe the examples around resuscitation, teaching students blood pressure or other things, maybe it could be an LGBTQ+ person. Having an objective look at our assessment strategies and thinking, where might we integrate from, say, a mental health perspective? If we're assessing depression or anxiety, might it be a trans person? Thinking about, in terms of our practice assessment documentation, is there places throughout that where we can signpost under equality and diversity some of the specific conversations or learning opportunities around LGBTQ+ health and the distinct and specific needs of LGBTQ+ people? and that we can use some of the best practice examples that we have identified to build on and weave this thread throughout our pre-registration nursing and midwifery programs. So what we think ultimately needs to happen, and as I said right at the very beginning, we tried to keep this simple. I understand that delivery of programs is complicated. It gets more complicated by the day. We're increasingly being asked to recruit more students, find more practice placements, look at quality, the positive student experience. And within that, we're now saying, can we think about where LGBTQ plus health sits? So I think a starting point could be for every School of Nursing and Midwifery, maybe to set up a small subgroup, perhaps of their equality and diversity work, to review their current nursing and midwifery programme, to actually identify where, if indeed it does sit, LGBTQ plus health is reflected, and from that to then identify small opportunities where it can be further enhanced and embedded, so that we're thinking about how we systematically integrate and develop in LGBTQ plus health across and within every nursing and midwifery programme across the 135 universities who provide them. So we're thinking about the theory, the skills, the practice, and the assessments, and how we weave this thread. Ultimately, what we think we're trying to do is increase the visibility and reduce the invisibility of LGBTQ plus health across and within every nursing and midwifery programme across the United Kingdom and the Republic of Ireland. That's our ultimate big goal. So if we came back in 3 years, 6 years, or 10 years, we would be able to find that thread at the start of the programme and follow it through in small ways that therefore reflect the needs of LGBTQ plus people, so that our students upon entry to the register feel knowledgeable and confident around the health needs of LGBTQ plus people. A really interesting suggestion that came from some of the students was that maybe one of our starting point needs to look at the knowledge and confidence of the academics around this evidence base within our institutions, and maybe they could be involved in educating us around some of the needs of LGBTQ plus people. We will have students who are lesbian, gay, bisexual, or transgender, who will have their own experiences, and maybe that is a very important opportunity that shouldn't be missed. Something certainly from a UK perspective, as the Nursing and Midwifery Council looks at practice hours and the numbers that need to be achieved and will need to be achieved moving forward, is the place that skills simulation may well play in our pre-registration programmes. So therefore, there's opportunities when we're providing education about health needs assessments, taking histories, formulating care plans, looking at communication across people with visual impairment, hearing impairment, BAME groups, learning disabilities, people with dementia, the list goes on. We can be thinking, well, how do we look at language and communication in relation to LGBTQ plus health? I think ultimately we're not asking for people to reapprove and revalidate their whole pre-registration programs. It's thinking about where there's opportunities to embed these issues and address these concerns. And a really important one was that we found as a result of doing this research study was that your local LGBT organisations seem very keen, willing and interested to be partners in looking at your programmes to see where opportunities can be exploited. They're interested in coming in to speak to students about their experiences, good and bad, and about what we can do as nurses and midwives to ultimately improve the care experience when LGBTQ plus people access healthcare. And I think What we're asking is that people look at naturally occurring opportunities across our programs in things like skill simulations, OSCEs, module assessments, clinical portfolios, whatever you call them, where you are, and how we can, in small ways, embed and reflect the needs of LGBTQ plus people. And that will look differently in every institution. So I think now what we're going to do is maybe move into a little bit more of an open forum. We'll bring Brian back in here. There's our contact details there for myself, for Edward, and for Frida. We'd really welcome contact discussion. Something that we've been discussing, and I don't know the answer to this, but be interested, Brian, to see people's thoughts in the chat. Is there scope for us to develop an academic network around improving LGBT health? I think there is probably a lot of good work going on, and it's really how we collect that and share it. So there may well be something there that would be useful. So that's our contact details there. And thank you very much for your attention, and back over to you, Brian.
Thanks very much for that, Michael. And just want to start by saying a huge thank you to you and Frida and to Dr. McCann for this work and for sharing it with us in this webinar today. There's been a few questions that have come in. I'm just going to continue to encourage people, if you want to ask a question or make a comment, please put it in the chat box and I'll try to bring it in at this moment so that we've got a bit of a discussion. We can hear from our colleagues just what the response might be. Michael, if you don't mind, I'm going to start with that point that you just finished on around networking. And in the report, which I know you're going to send electronically to attendees today, but in the tips and advice bit, there was a part there around networking. And in the kind of summary that you gave at the moment, there was issues there about networking with local organisations. And you've talked there around networking with academics. And that was probably one of the obvious things that was jumping out at me as you're beginning to talk, that potential for universities to find support on curriculum issues and be able to develop scenarios and approaches together. Is that something you think could be self-stimulated from members here? Or is that something as researchers that you think you could follow up? Or how do you think that would work, Michael?
I think probably both, Brian. I don't think it's an either or. I think we need to work on several different fronts. From the work that we did, it was very apparent that local LGBT organisations, they were very keen to be involved. They wanted to support educators in the curriculum. So I think there's something locally that each institution can really take forward itself. Something that's really interesting, when we did the literature review and some of the keywords looking at equality and diversity, what came up, and it was fascinating, was universities' individual EQ policies. And LGBTQ plus health was in there, obviously, about inclusion, respect, diversity, and all those kind of issues. But we had to remove them and sift them out. So there is clearly recognition on behalf of the universities about the rights of students and academics around BAME, their inclusion, LGBT, or whatever that may be. So I think universities will be very receptive to this. I think really good starting points are the helping professions like teachers, social workers, nurses, AHP, medicine, clinical psychology. So if in your university you have a network there, I think there's something that internally you could already be doing. And I think I would be astonished if the executive in your institution did not see this as an opportunity, because it would enable them to deliver lots of outcomes, as well as enhancing the learning and the students. And I do wonder, just as we've been preparing for this, I think, could we potentially, using the technology that we've been forced to use as a result of the pandemic, be thinking about how we bring together people who are interested? I think our message is try and keep it simple. It doesn't need to be all and everything. But if we all do 2 or 3 small things in our programs for nurses, for midwives, for medicines, for social workers, that will be 2 or 3 things more than what we're doing now. And if we can then embed them and share what we're doing, maybe there is a place for an academic network where people can share and disseminate, discuss. Don't know, that's just one that's appealed to us, but I think there's some early wins here.
There's certainly a lot of comments coming in of people saying I'd be 100% interested in a network. It'd be a really good opportunity to share. I think I would be the first to say, as an openly gay man who's written many curricula, I come with a lens and a perspective, and it's really the value for me is on hearing other people's perspectives and experiences of what they're doing in curricula to actually get the right approach that could be adopted. So I think there's a lot of appetite out there for a network, and it's something I think could be done nationally as well as locally. And it'd be really good to see what we can pick up following this webinar to see how that could be done, even kind of making contacts or getting some few abled people who really want to stimulate and start that and then get the word out to do something about that, Michael.
Yes. So maybe there's a conversation that we need to have separately. I mean, we already, through the Council of Deans, through the newsletters, through the networks, could potentially look at what that might look like. So maybe I could commit out with this dissemination event, have a conversation with you to see what that might look like, and then maybe take it back out through the academic networks.
That would be fantastic. I'm going to ask Michael and Frida if they can just put the cameras back on, because I'm feeling a little bit lonely speaking to a slide with my name on it. There's a couple of questions. I'm going to throw them at you just to kind of see what your responses are. And I'm going to go back to one at the very beginning, which is from Gerardina, who works at, she's a head of nursing in one of the colleges of nursing in Ireland. And it is about terminology. And I know you talked about this at the beginning, Michael, and I know you've talked about it in your paper, but just really trying to understand the rationale for selecting LGBTQ plus and why the I wasn't used in particular. Just give us a bit more understanding of that.
Again, thanks, but I mean, a lot of people have asked us that. I would say out of all the dozens and dozens and dozens of papers that we've published, every time they've gone in for review, all the reviewers have told us to change it to the one that they personally prefer. So we tried to use one, and we took guidance and advice from LGBT members on the advisory group. That's the one that we opted for. I know there will be views around alternatives, and already it's changed. So language changes constantly, and that was the one that we were advised to use. So that's the one that we went for, and we recognise that there's a range of others.
Thanks for that, Michael. And I'll probably stick with you for this next question, then I've got some for Frida. In relation to regulator and standards, and it's great that we've got Emma from the NMC with us today, who's their EDI officer. So welcome to Emma. David made a comment in the chat around some of the challenges that might be there because we don't specifically mention in the standards anything to do with LGBTQ+. They're not visible as part of that increasing visibility.
Yes.
What's your kind of perceptions on that from the work that you've done?
I spoke at an NMBI conference in our, well, no, sorry, the chief executive in NMBI spoke at the same conference as me that was hosted by LGBT Ireland not that long ago. And this issue did come up. On one level, I'm going to contradict myself probably. On one level, I don't think the standards need to. But I think when programs are put up for approval, these questions need to be asked by the people who are scrutinizing them. And I think that's where the issue, the standards are obviously being interpreted by the universities and the providers. And I think then maybe it goes to when programs are being reviewed internally, who you have on the membership of that, and the LGBTQI+, I'll add the I in there, are all included. That's the first bit. And then when we're developing the programs, the curriculum, the content, the assessment strategies, again, that is reflected in it. So on one level, I can understand why equality, diversity in terms of NMC and MBI standards are very broad, because they need to be interpreted. But I think that inadvertently could mean that this issue is missed and it's not picked up. And if at the time of scrutiny and validation, it's not been questioned, then it probably does fall down to an individual or a small group of individuals internally to push for it. I don't think it's deliberate. I don't think it's willful. I think it's unintentional, but there's an opportunity to address it is, what I think.
It's quite an interesting dilemma, isn't it? Because you've identified in your study that actually work around LGBTQ plus issues in the curriculum was a bit patchy and was a bit dependent on the academics within the organisations. Not completely, there was some great evidence, but actually it's us as academics of nursing and midwifery curricula who also volunteer to work for regulators to approve curricula in other institutions. And actually, there might be something there about training requirements for individuals who are approving curricula. Yes. I would probably say that about the new standards we had in the UK around nursing and midwifery. They're set a little bit higher, but actually my own experience of going through curricular review was more of the same in the sense of assessment. I didn't really get asked lots of things about how we were going to achieve some of the higher standards that are in there. So maybe there is some thinking to be done with colleagues at the NMC and other regulators in Ireland around how we train those that assess curriculum when they're going for approval.
Yes, I think that's a fair point, Brian. I think so. There's two issues that fall from that. You're quite right. There's the bit about people who regulate and what they look for and what their own knowledge and skills are. And then there's the academics who develop and deliver, and then how we bring people in to ensure that we're addressing the range of concerns. And it, as I did say towards the end, it came from the student body that perhaps some of the more mature, crustier academics could possibly learn from and exploit, for example, the LGBT student body within their HEI. So there's a lot of opportunities there, and maybe through networks locally and nationally, if that's the way that we go, maybe we could pull some of that together. The other interesting point is, as Frida said, we've got about a 40% response rate. Now, that could be that by doing surveys, it's always notoriously difficult to get to the right people. We didn't hear from many HEIs, and it could be they looked at this and said, we're already doing this. We don't need to participate. Or it could be that some thought, oh dear, we're doing a bit dismally here. We don't want to expose, we don't actually know what the answer to that is. I suspect it's somewhere in the middle, I suspect. I don't know what Frida thinks, but my take is that most academics who are they're trying to do their best here, and they recognize that they could do better, that we could do more, and that they would welcome additional training, education, and support themselves. So I don't think it's lack of willing. I really don't think there's a lack of willing.
Certainly with my own university, our LGBTQ plus staff network, two big things came out in our last discussion. Staff were desperate for information around curricula. How do you teach curricula? How do you include LGBTQ plus issues in a curricula? What's any tips and advice that people have? And the second issue was around confidence. And there was an absolute fear of language. Yes. And many of the members were saying, I'm not sure I understand all the terminology, definitions. It seems very complex. I'm really scared to get this wrong. And that's quite a sad place to be, but one that can easily be addressed.
I think that's a fairly common issue, Brian, is this confidence around language. I did a session for our students at Queen's where I had every anachronism that I could possibly find and asked the students what all of them meant. And they did admit for some of them that they were guessing and that they didn't know. And I think part of it is a fear of causing unintentional offence. So therefore, we don't do anything. which actually causes a different kind of offence. So I think people are deliberately and willfully saying, I'm not going to be nice to LGBTQ plus people. I think it is about confidence, knowledge, and skills.
And it's great to see David's just made a comment in the chat saying, well, we would never think of writing a curriculum without mentioning BAME attainment gap. Yet LGBTQ plus users are still hit and miss, sometimes tokenistic.
Yes.
And Emma from NMC has said, great webinar. Thanks very much for that. I'm going to take some of these thoughts back and talk to relevant teams about them. So thank you, Emma. That's really great to see. I've got a couple of questions, Frieda. I'm going to start with you. They're from Professor Catherine Meads, who's a professor, I think, if I'm right, at Anglia Ruskin. Yeah. So if I've got that wrong, Catherine, apologies. Couple of questions there. One was about the survey. And she's saying that your survey seemed to have had a low response rate. What do you think would have enhanced that rate? And it might be useful just to talk about the timing and where we were with COVID as well, because who knows, that probably had an impact on it.
Absolutely. I think whenever the survey was launched, like this time last year, and we were just coming to the peak of COVID, people were working from home. There was a lot of homeschooling and that, and maybe people weren't as focused maybe on surveys and that coming in to give it the time and attention as well. I suppose we were fortunate to get the response that we did get, and it certainly gave us a good feel for the data. What we got in there, we were absolutely thrilled with as well. What would we maybe do differently? It's a very, very hard one to say. Perhaps we maybe just targeted the head of school, one person within each university. Perhaps maybe if we also maybe went to a deputy head or another person, or maybe go to the administrator themselves and let them liaise with the head of school. It's a difficult one, Brian. It's a very difficult one. What would you do against circumstances? And more so, it was getting the contact as well. There was a lot of internet searches, let's say, going on to get the contact person and the emails to be able to get a circulation list as well. So yes, good question. Good question.
We were also required, Brian, just to come in there in the back of Frieda, by ethics, that we could not go, we were only allowed to recruit through the head of school, then onto an independent admin person. It was not originally how we had conceptualized the recruitment strategy, but we were required through the ethics process to change it several times. So whether that, I think it's complex and it probably needs a range of different routes in to be able to capture it. But yeah.
And Michael, I've just asked that same question to you around if you were doing this again, you were the PI on this, if you were designing this, would you have done anything differently?
I think so. I mean, we're always wise after the event. Did not anticipate the pandemic, so we had to try and navigate our way through that. It just brought, again, literally, we had already got ethics by this point, so we had to rethink actually quite a lot of the approaches that we were going to take. So we either had to not conduct the study or to do the best that we could in the circumstances that we were under. But I think probably the biggest take home would be the approaches to identification of the key people. It was really interesting. Some HEIs couldn't even tell us who was delivering it or what it looked like. So that tells a story in itself, the fact that they didn't actually know who was responsible for this. In some places there were teams of people, in some people it was an individual. It just varied so greatly that probably the route into the universities and multiple routes in would probably be the biggest take home.
I think it's a really important point. Myself and a colleague from Edinburgh University, Professor Aisha Holloway, did a survey to all nursing and midwifery schools in the UK around alcohol and its inclusion within the curricula. And actually our biggest challenge was finding the right people within the schools for that to go to, and it not sitting in a dean or a head's email box when actually they've got 101 other things to do, and this doesn't get to the top of the priority list. So there probably are some engagement challenges that might be learned from many studies, actually.
Yes, absolutely.
I'm just going to ask another comment, really, just for your thoughts. This is from John, whose pronouns are he, they. And he says, thank you so much to researchers for leading this work, vitally important and so useful for those of us working in this area. However, one of the biggest concerns I have around the LGBTQ plus inclusion in healthcare curricula I have seen is it tends to be very homo/cis normative, when itself can be very exclusionary.
Yes.
What would your thoughts be on that, Michael, from the work that you've done?
I would say that goes to a point that Eddie and I became aware of ourselves, even as we were writing about this, going back years, because we've been doing this for a long time. And I think there's an opportunity to recognize, and I tried to make the point earlier, was about the very distinct differences and similarities across the L, the G, the B, the T, the Q, the I. Almost when you start doing that, you then become overwhelmed, because you then think, oh, we're trying to keep this simple. We're trying to capture this within the program, but there's such diverse differences between, say, a lesbian pregnant woman and a gay man who's end of life as a result of whatever, so I think there's some overarching principles that we can do, and that we can't tackle everything. Maybe some of this, there are universities, departments who have gender and sexuality departments, who have programs. So maybe at a post-registration, postgraduate level, we would already be thinking, what do our pre-registration students need to know about cardiac care? We would recognize we couldn't cover everything, and that some of them that would be picked up at a post-registration level. And I think this could be an evolving issue along a similar line, to be honest. I don't think people should feel bad about not being able to do everything. I think if we all do something, then that's better than what we've got just now. Some people will lead the way. Some of them will be happy to follow. But I think if we, as I said, we can find that thread that leads us through what we've got at pre-registration programs, and then think, what are the opportunities in our post-registration, postgraduate programs? Then that would be another step, or another bit of the jigsaw.
So I might come back to that bit, Michael, around CPD, postgraduate, post-reg, ongoing training, and just see where your thinking is around that. But I guess what you're saying very much aligns with some of the earlier comments you said around keeping it simple. Don't make this overly complex. Start and build and thread through a curricula, but keep it simple as a start, and then allow it to grow, maybe evolve through the curricula per se.
I think NMBI published their standards for the NMC. So many of the pre-registration programs down in the Republic have already gone through the reapproval process. So therefore, it's about picking up what you've got now. Yeah. And then when you're coming through, programs tend to be every 5 to 6 years, roughly, when they have to be refreshed. So that's, I think, a really good opportunity to think, when we do our review of our existing program, how do we bring in people with knowledge, skills, expertise and interest around LGBTQI plus health and get that input? And I think it is trying to keep it simple. I know when you're developing, everybody wants their particular issue into the pre-registration program, and it can't happen. But I think there's ways that we can embed this, and I think we need to be clever about the way that we do it and the different ways in which we do it, and keep it simple, not trying to inhibit anyone. If somebody says, well, we can do a lot more, then please share with us what you're doing, because others can learn, I would say.
And some of that goes back to what Frida was presenting on in relation to the education guidelines, and even issues such as assessment, to actually make sure that we incorporate thinking around LGBTQ plus issues. And Frida, I'd like to stick with those education guidelines. Of course, my eye, when you put the table up, directly went to the one about elderly and LGBTQ plus issues. As I come to the end of my career and my aging years, I want to make sure that people are going to look after me properly. What's your thinking about how would we keep those education guidelines alive, contemporary, current? Is that something you've given much thought to as a researcher around, are they a moment in time, or do we need to keep reviewing these, and how would we do that?
I suppose we certainly don't see it as a moment in time. We would like to keep it live and keep updating the education guidelines, because obviously there'll be new resources, new literature comes along. We're talking about a network perhaps of academics as well. Perhaps this could be an online resource that could be kept updated and added to as time goes on. At the moment, I say we have it here, it's in this format, but certainly there is scope for it to be developed and increased as time moves on as well. Definitely, it's a living document, hopefully, yes.
And if the network idea was to take off, of course, that could contribute to keeping those guidelines alive in a web-based format for people to access. So again, two things and thinking go hand in hand, that actually something could really grow from this, which would be fantastic to see.
Absolutely, and again, we have put into the guidance, what we have ascertained out of the study findings and that. But I'm sure through a network, and I'm sure even people looking at that table as well are thinking, why did you not include this? Why did you not do that? There is scope. It's a basis. It's a foundation stone that hopefully could be built on and grown as time goes by as well.
Thank you, Frida. It's 12:47. I've got a couple more questions and I'm going to squeeze in before that 1 o'clock deadline, and we all go our separate ways. This question's from Ella, and Ella said that you've spoken about deconstructing LGBTQ plus because there will be different experiences. And Michael, you were talking about that just a few moments ago as well. However, the question is, did you feel it important to explore differences in experience with respect to class, poverty, race, and how they intersected? So it's really about intersection, really. And again, I thank you for this presentation, but it's those issues around intersection.
I think that goes to the culturally competence bit and what that looks like within our programs, and a very honest question that program developers and deliverers need to ask: to what extent we can do that around individuals, around families, around communities, and around populations. Because as I said at the start, health is a global issue, as we've seen over the past couple of years. And LGBTQ plus people move across the world. So therefore, I think that whole we specifically have reflected what people told us, and there could well be limits in terms of what we did ask. But I would say in terms of the wider literature, there is certainly recognition of the need for curricula to be more culturally competent and transcultural. I would definitely say that that is reflected there. Maybe we've got a bit of a way to go in nursing midwifery programs, how we do that in general, and then how we specifically integrate and reflect that regarding LGBTQI plus people is another issue that we obviously need to address too. I think there's a window of opportunity here. I would like people to go away feeling enthused and positive that this is, for some of them, maybe the start of a journey, and that we're not going to achieve everything overnight. It's these small steps, it's the bits of the jigsaw, and how we embed over time. And I think that whole point about cultural and transcultural differences is something that nursing and midwifery and healthcare programs in general need to address comprehensively. And then the LGBTQI plus is a bit that sits alongside that.
Thank you, Michael. I'm just going to draw people's attention to a comment from Niall, who's an occupational therapist, and says that in addition to publishing the best practice guidelines for OTs working with LGBT plus clients, we've also established an advisory group to continue developing the conversation and resources. And that may be something that others in the room may want to talk to Niall about or think about how they might do for themselves. And I guess it raises the issue around how do we explore cross-disciplinary perspectives around curricula and actually look at the kind of more interprofessional approach, which is an obvious comment, but one really well made. I'm just going to try and squeeze in another question, Michael, which is from Anita. And Anita says, what do you think would be the optimum way to engage other faculty members about the need for more learning, teaching around LGBTQI+, when there is resistance? I guess it's that issue about when there is resistance, and that resistance might come out of fear, it might come out of misunderstanding, it might be phobic, it might be pressures on the curricula, it could be a whole range of issues. It'd be good to hear from both of you on that one. What do you think would be the optimum way to engage with faculty members?
I think there's a range of ways that we can do that, Brian. So if, for example, your organisation has an LGBTQ plus staff organisation, you're probably going to have like-minded people there who may not be educators or academics. I'm involved in ours here at Queen's, and it's a wide and diverse range. But there, for example, is an opportunity there. There's the student networks, so there's opportunities there. And I think as well, organisations like Advanced HE, so people who are doing fellowship, senior fellow, principal fellow, there's opportunities to address some of those issues. So for example, when new academics join institutions, they'll invariably be supported to gain Advanced HE recognition. If their institution is an Advanced HE approved institution, to provide the recognition of associate or fellows. There's opportunities there. I think there's conversations to be had. I would start with the people of least resistance. I would bring them together, bring up a critical mass of people who have an interest, and I would keep it simple, and I would start to look at ways to embed theory, simulation, assessments within your programs. And then most universities will have dissemination events, newsletters, webinar, blogs. Every single opportunity, I would be drip feeding what you're doing and sharing it. And if you can develop a local network where you can be saying, we have expertise here that can assist you with your program, then I think if we do some of these things, we'll just gradually start to shift things and move them forward. Don't know what Frida thinks, but that's some of my early thoughts.
I would wholeheartedly support with what you're saying there, Michael. And I think it's important, you know, to let people know these opportunities are available, and also that there is support and resources there for them as well. Absolutely. Yep.
And there's a comment there you may want to follow up with, Catherine, or go direct to Burdett, who's saying, do you think the Burdett Trust might be interested in hosting a website to take forward some of the initiatives, such as the networking, teaching resources, etc.? So that may be something you want to explore with them.
I've already been speaking to them, Brian. It maybe comes as no surprise. And again, I think there's a conversation for us to have with them around, because they're already supporting, for example, a transitions network in England for people with very complex needs. So again, I think there's a window of opportunity there. And the fact that we can see so much interest there in the chat means that maybe it's something that we do need to try and take forward.
Thanks for that. And just to say to people in the webinar that actually, if you go into the files section on Webinar Jam, we've now shared the final report for people who can access it there. So you can access that through the files part on the right-hand side of your screen within Webinar Jam. One final question, because time is not on our side. You're both very experienced researchers. You've given a lot of time and energy to this project. There's been a huge number of people in the chat who've said, great webinar, really important. Thank you very much for this. It's been really stimulating to me. As individuals, I just want to ask each of you, what's your biggest personal learning been from doing this work and writing this report? Frida, I'm going to start with you, actually. What's your biggest learning been as an individual?
I think my biggest learning has been the vast interest in the topic that is out there. People are doing their best. And I think one of the key things is, don't be afraid to ask questions and go, because there is the support. People do forgive you if you use the wrong words or do the wrong things. And I think that very much came through in the interviews as well. Yep, believe in it and go forwards with it. Yeah,
that's really encouraging and great to hear, Frida. So thank you. Michael, what about yourself?
Mine would probably be do 2 or 3 small things really well within your program and then build on it. Keep it simple and build on it over time, and get a network of champions who can just quietly drive it forward, and that will affect change over time.
Thank you for that, Michael, and thank you to all our participants today. Thanks for the questions. Feel free to access the slides that the report that's out there. Really, really important. There's been a lot of thinking there for us today, a lot for us to get our heads round. I'd ask you to ride on this encouragement, take the report, have a look at it, look at the information. But actually what we're trying to do, this is such an important topic for us. What we're really trying to do is really produce the professionals for the future, for the here and now and for the future, to really help them in their understanding of being inclusive, holistic, to provide the right care that we want. I would ask each of you to think about what your next step could be from today. How are you going to share with your colleagues in your workplace around the report what you've been learning? Is there a way that you can stimulate some engagement, either at strategic level, within your department, within your faculty, within your practice area? And what change can we contribute to as individuals and as organisations? We have a real opportunity to make a difference. Michael and Frida, I'm sure you're not able to follow the speed of all of the chat, but the comments of thanks for this work, descriptions such as groundbreaking, inspirational, really important, really informative. Huge thanks to you and your colleague, Edward McCann, for this work. Thank you to all of those for attending. Have a look at the report. Don't forget the publication that Michael's identified that came out today, which, if I remember rightly, Michael, is in the International Journal of Environmental Research on Public Health. That's right. And if you search for the author's names, you'll come up with that online, I'm sure.
It's actually free online. It's open access, Brian, and it's there on the journal homepage.
Fantastic. Thank you very much to that. Michael, Frida, any closing comments from you?
I just want to thank I want to thank you, first of all, Brian, because you've been an absolute brick behind the scenes helping us and guiding us. I'm really grateful for your time. I know you have 1,000,001 other things that you need to do, but I know you're passionate about this. And just to their academic colleagues, and thank them for their time.
Frida?
I would just like to thank everybody who made this possible, and so thankful that we've got to this stage and everybody is really appreciating the work that we have done. Thank you, everybody. Thank you.
Thank you. Thank you, everyone. Have a great weekend. Have a great rest of the day. Thanks very much for attending. We have really appreciated it. Thank you and goodbye.
Thank you.